We are teaching today on the science of ovulation. How can you know that you are ovulating? Many people have been asking this question. They will call, doctor, when am I ovulating? Doctor, how can I know when I am going to ovulate? I want to answer that question in this video today. So you listen keenly. Ovulation is the release of a mature egg from the ovary of a woman. This is what makes a woman fertile, because once this egg is released, it only demands a healthy sperm from the man for it to be fertilized, and that is how pregnancy comes. For a woman to get pregnant, the ovary must be able to release an egg that is mature. When this release happens, we call it ovulation. So anytime you hear a woman say, I am ovulating, am I even ovulating? Is just trying to find out if her ovaries, the organ that produces egg, what we call the ovum, if that organ has produced an egg and release it free into the fallopian tubes so that it can meet mature sperm and fertilization can take place. Now, if you are finding it difficult to get pregnant, if you have been in a sexual relationship, if you are married, and if you have been going for some time, months, years, and pregnancy is not coming, ask yourself if you have been ovulating. Are you truly ovulating? Because the day or the time you ovulate is a peak of fertility. Some women do not ovulate, and they don't even know that they do not ovulate. If you know that you are not ovulating, or you suspect yourself that you are not ovulating, you need to go to the hospital. You need to see your doctor, wherever. The experts are there to help you find out why you are not ovulating. But the question now is, are you ovulating? Can you tell the signs of ovulation? Listen to me now. 1, watery, slippery, cervical mucus. This is a situation where the secretion from the cervix is deep inside the vagina. So any woman, you know that when you wash your finger very well, this middle finger, you can insert it deep into your vagina. When you go and touch a part deep that feels like the bridge of the nose, that part is called the cervix. And when a lady ovulates, that area has secretion that is slippery, more watery. It's never thick. It's not even murky, But the fact that it looks slippery means that you just need to say your hand in your vagina, you'll get secretions. Hold it between your thumb and your middle finger, or your first finger, index finger. Just hold between the thumb, and then you just pull gently. You see that it forms a thread, long thread before you cut. That confirms that you're ovulating. That is the basis of Billings. Billings' method of contraception. Billings is a scientist who discovered that when a woman is ovulating, the secretions from the vagina become more watery but slippery. If she brings out the secretion from the vagina, hold between one finger and the thumb, and gently open your hand, it will draw, forming a thread. That says that you are ovulating. That's a sign. Yes, because at any time, normal secretion inside the vagina will not form that thread. You will just hold it between your thumb. You want to open a cut. You want to open a cut. It doesn't draw. Now, number 2. I am talking here about high sense of smell, high sense of taste. What some books refer to as heightened senses. Many don't know about this. A woman during her ovulation can smell the least smell around her. Her sense of smell is very sharp. She can quickly say, what is smelling here? Now, what did it smell for here? As if, she can make some people feel uncomfortable around her. You remove even your shoe. Now, when shoe smells, they cook the way around here, because anything you're cooking around the quarter, she can smell it. Sometimes we tell you that when your sense of smell is so sharp, suspect yourself, you are ovulating. Now taste. Like you eat something, put something in your mouth and it's nice. She eats even food without Maggi. Say, hey, fine. That job nice. I say, are you sure? Are you sure your mouth is still very fine? Even when Maggi is not there, you say it's nice. She can eat anything. This raises craving for certain foods. During such days, we describe in our local parlance that langa too much. When your langaron begin hot, ask yourself, am I ovulating? Because it is possible in some women, most women during that time, especially these two senses, smell and taste. They go very high. Number 3 sign that you're ovulating, breast tenderness. Breast, what my people call bobby. Your bobby will increase in size. You feel full, sense of fullness, enlarged breast. The nipple may be a bit painful. Or you may be feeling some tingling sensation. Even your nipple, even just your dress, you want to pull and it pass on your nipple and tingling sensation. It seems to stimulate you, it seems to tickle you. And you say, oh, my breast, the science, the way it is doing these days, I might be ovulating. Yes, because I don't want to go into detail of what is happening in your system at that time to react like that in breast. But when you notice those signs on your breast, suspect ovulation. Now, number 4, basal body temperature. When we say basal, it means at rest, your body is supposed to have some normal temperature. At rest, if you just sleep, wake up in the morning early, and you monitor your temperature, we refer to that as temperature at rest, basic temperature, and that is the basal body temperature. But you'll notice that when you are ovulating, your temperature, basal body temperature, will increase up to about 0.5 to 1 degrees. Yes. A lot of women monitor their temperature every morning. As soon as it rises from bed, whether it's 5:36, the first thing she does is just get the thermometer and monitor her temperature and write it. Every day. The days she will notice that it is slightly increasing, it means that she's ovulating. Even though there are other factors, there are other things that may cause temperature to increase, like you get a disease, you may have simple malaria or other things, it will raise your body temperature. But we are talking here in a case where the lady is not sick, she's very healthy, her body is functioning very well. During ovulation, she's going to notice a rise in basal body temperature. Number 5, are you ovulating? Number 5 sign, ovulatory pain. There is a characteristic type of pain in the underbelly, lower abdominal, the lower abdomen, either on the right or on the left, depending on the side where the ovary has ovulated. When the ovary ovulates, it means the ovary has released an egg. Usually, where the egg comes out, it cracks, breaking, some blood vessels there crack. The tear and blood leaks out of it, okay, and see there's some form of internal bleeding into the abdominal cavity inside there, and the tissues around there that trap the blood, they inflame, they swell, they redden and become more painful. They may produce some characteristic kind of pain within those days around that area, and a lady can feel some pain mostly on one side and tell you that it looks like I'm ovulating. Yes, some women have studied this. We refer to that kind of pain as tenderness. A 13-letter word, tenderness. MITHERS. Mess. That is the term referring to ovulatory pain or ovulation pain. That is the pain coming from ovulation. Just like dysmenorrhea is also 13-letter word, but the word dysmenorrhea is painful menses. But you see, if it is painful ovulation, we call that one tenderness. That is a typical sign. Some women know this. Take note, study it in yourself. During those days, you are going to notice this tenderness. Number 6, increased libido. My dear sisters, during your ovulation, you hungry for sex. Your desire for sex increases. You begin to look at men, some pass you, your body make inside like that. You hungry for. Many have said that they are the ones who will touch their husbands, who will touch their partners. The ladies would touch the man and request for sex. Yes, because her desire for it increases. I used to tell women that when you have given birth and leave the labor room and go home with a young baby, be very careful, because when your fertility returns, you will notice when you suddenly desire sex, when you suddenly feel stimulated, when you suddenly feel like hugging your partner, a man, and your husband, and requesting for sex. We tell you, don't you think that this upsurge of increased desire for sex is a sign of ovulation? Yes. This is why some women give birth and baby is still 2 months, 3 months, 4 months, and they just discover themselves pregnant. And some will telling you, I not be seeing my menses, so I knew that I was not yet fertile. No, madam. Fertility will return with ovulation. And ovulation is usually a silent sign, okay? A silent occurrence, a silent process that you might not quickly notice. And it is only when ovulation fails that menses will flow. Why are you waiting for menses instead of waiting for ovulation? Now I will tell you, note the signs of ovulation, because you may safely get pregnant, as well as you could know when it is possible for you to get pregnant just by taking note of the signs of ovulation. So, increased libido is number 6. Number 7 has to do with changes at the cervix, cervical changes. When a lady washes her hands clean, send the middle finger deep into the vagina, she will notice that the cervix, she goes inside and touch, turn around, you will touch a part that looks like a ring, but it feels like the bridge of the nose. This area I'm touching like this. When it feels like a bit firm, a bit hard, okay? But when a woman is ovulating, she will go and touch that very cervix and it is softer. It is now feeling like your lips. You see, touch your lips. Your lips are soft. Go and touch the nose. The nose is harder. When somebody is not ovulating, the cervix is harder. When she is ovulating, the cervix is soft, like the mouth. This is where I say that knowledge is power. My dear sister, listen, learn, and teach others. Explain it even to others. They will understand, and these studies will make us all grow. Okay, the cervix again during ovulation may be a bit open. So your one finger may go and touch the middle part of it, and it looks as if there's hole there, as if you press it to enter, even though it is not open. But because it is softer and the hole in the middle is a bit wider, it is a relaxed. It's a bit open. During that time, it is a bit open, ready to receive sperm and allow sperms to flow inside. And the cervix again during ovulation is deeper. If a woman is not ovulating, she may send her finger into her vagina and go just not too far and touch the cervix. But when she's ovulating, she may put her finger in the vagina and need to go deep before you could touch that cervix. It looks like the cervix are pulled inward. Yes. Very common during ovulation. That is how a woman can use even her finger to test her cervix inside and know whether she is ovulating or not. Number 8, increased salivation. Increased salivation. It is out of great experience that some scientists, that some of us have confirmed this. When a woman is ovulating, anything around her easily stimulates her sexually. The things that bring about sexual stimulation, they stimulate the salivary glands. Hello? When your man begins to touch you in some kind of places, romancing you, touching you, you're getting hot, you're getting sexually excited. At one moment, if you are really sexually hot and the man leaves you, if you listen even to yourself, you notice that the level at which your salivary gland is secreting is high. You keep swallowing saliva. But what are you really swallowing like that? If somebody listen, bring the chest very close to you, you notice that the rate at which you are swallowing spit, saliva is high. Your salivary glands are also stimulated. Therefore, if at a particular moment you easily feel like saliva is the rate of saliva is increasing in your mouth, suspect yourself, you could be ovulating. Now, number 9, bloated abdomen. You feel full. Is it even just abdomen? Your whole stomach, it just feels like it is already full. You find within those days, you know what we describe as bloated stomach, a feeling of fullness. If you feel like your stomach is just standing inside. I like what to really describe that. Number 10, which is final, is a test, laboratory test for ovulation. My sister, do you know that there are strips to test for ovulation? Yes. They are in the market. They are in the laboratory, which is the better place for you to go. If you really want to know whether you are ovulating, then you will be using strips to test your system for ovulation. And when you will ovulate, you will use the strip and it will be positive. It is good for people to know how to follow themselves to confirm whether they are ovulating. If you like this video, subscribe to this channel, Dr. David Reproductive Health. You like and share. Especially for people who are watching me teach on YouTube for the first time. My name is Dr. David Ayin. I am a reproductive health expert and I hold a PhD in public health. Call me or write on WhatsApp anytime, any day, 674-605469. If you are out of Cameroon, you can only add or start with +237. Then add my number. You will get to me. Ask your question. Make your comment. And we are good to go. Thank you for listening.